Martin Laverty, welcome to ABC News 24.
Thanks for having me.
If I could get first an idea of how many aged care homes, residence facilities your organisation represents and looks after?
Well, around the country today and on any given day, 1 in 10 older Australians are being cared for in a Catholic aged care service. But very importantly, many people are also cared for in their own homes. And that's what we're looking towards the Productivity Commission understanding when it releases its report in a few days' time. Much aged care today is happening in its own home because that's where consumers want to be looked after. If you think about your own family or your own interest, you're going to want to be cared for in your own home for as long as you possibly can. And there's many constraints around being able to do that today. We work under an aged care system that was first set up under the Hawke government in the 80s, tinkered with by the Howard government in the 90s, and now needs major reform by the Gillard government early next year. And that needs to be built around putting consumer interests first. Because, Lyndal, regrettably, today there is a rationed system. There's 113 aged care places for every 1,000 people aged over 70. Now let me put this question to you. What happens if you're number 114? It means you miss out. So right around Australia at the moment, there's some unfortunate and some perverse outcomes from the aged care system today, where consumers don't get the type of choice they want and very often go without the type of service they need.
The Productivity Commission will be releasing its final report in early August. It's already produced an interim report. Were its findings then along the sorts of lines that the sector wants?
Oh, absolutely. What the Productivity Commission has said is that we need to remove the red tape that has meant that consumers don't get the types of services they need. At the moment, the current regulation means that someone going into a residential aged care service can be accommodated, but the provider is only able to be paid half of what it actually costs to provide the service. Access Economics were able to release a report just a few weeks ago that said it costs about $60 per day to provide a residential aged care bed. Yet the revenue that the provider receives is about half at $32 per day. If we look across our aged care services, and Catholic aged care services operate about 22,000 residential aged care beds, we can't continue if we're losing half of our operational costs each day just because of an out-of-date regulation system.
Will the trade-off, though, for consumers being able to have more choice in what they want and what they get, be that those who can afford to contribute more do so?
And there's two choices as to how we can fund aged care services in the future. There will always be a role for the taxpayer to ensure that those of low financial means, those that wouldn't be able to afford access to care, can be guaranteed it. And the Productivity Commission has said aged care should be an entitlement. Everybody should be entitled to aged care if they're assessed as needing it. And the taxpayer is being asked, as they do today, to continue to provide access to care for those of low financial means. But for those who can afford to contribute to their care, what the Productivity Commission is saying, and what we encourage both the government and the opposition to act on, is that we need a system where wealthy people who, during their lifetime, accommodate themselves in their own home. Like Lyndal, you and I, we pay our mortgage, we pay rent. It should really be no different in aged care. And at the moment there are prohibitions on that, so that I can take you to aged care homes where there are millionaires who want to be making a contribution to their care, but it's simply not occurring because of out-of-date red tape.
So what precisely is needed to get more beds into the current system, to get more support for those people who want to stay in their own home, and get some money to help the taxpayer from people who can afford to pay?
Well, we need a new way of engaging with older Australians. At the moment, it's the system that determines what's available to the consumer. It should be the other way around. So what the Productivity Commission has recommended is that there should be a new Australian Seniors Gateway. It's a one-stop shop, if you like, for an older Australian or their family member to take advice on where they can get services and to give to that consumer the power of the purchasing decision. That individual then be able to decide, can they stay in their own home or do they want to go into a residential service? Part of that will be a system to create a mechanism so that an individual who can afford to is able to contribute to some of those costs of care. And very importantly, the Commission is proposing that a body be put in place to oversee that, so that there's not the opportunity for older Australians to be unnecessarily out of pocket. But realistically, if we are going to be able to have a viable and a financially successful aged care organisations into the future to care for older Australians, we need more funds, we need more revenue, and that's what the Productivity Commission has worked through.
Julia Gillard set aged care as a second-term priority for the Labor government. From your discussions with the government, do you think they will do the sorts of things the sector needs? And do you think this is one area where the opposition needs to provide bipartisan support?
Absolutely. The signs from the government are strong. Minister Mark Butler and indeed Prime Minister Gillard have kept to their word. They've promised aged care reform would be a major plank of this term of government, and all indications are that's occurring. But we and others have been working closely with the government to do all we can to make sure that government understands we're not toying around on this. If we don't get aged care reform now, what we will get in the years ahead is older Australians going without roofs over their heads. And I'm not wanting to play it up, but since 2004, aged care organisations have been operating on the brink of financial collapse in some circumstances. The government knows that, and the government is keen to fix it. Similarly, the indications from the opposition are that they understand action is required. There's many in the opposition who know that when they were last in government, they actually should have acted on these problems. Financial challenges started to affect aged care services in 2004 when the Howard government was still in office. It's regretful that the Howard government didn't act then. There's now an opportunity for the Abbott opposition to work with the government to come up with a package that puts older Australians first and gets politics out of the road.
Martin Laverty, thank you very much for your time.
Thanks, Lyndal.